These are the steps that can be taken when obtaining an arterial blood gas. First, review the physician's orders prior to obtaining the ABG. Review the medical record for coagulation or bleeding problems the patient may have to determine patient risks when obtaining the ABG. Also review the medical record to determine if the patient is currently taking heparin or Coumadin or any other blood thinner, as this will also prolong bleeding when obtaining the ABG. Communicate concerns and risks to the physician in order to protect the patient. Check the medical record to determine if the patient is allergic to chlorhexidine gluconate, ChloraPrep, or betadine solutions. Both can be used when preparing the skin for puncture. Hi, Mr. Smith. Hi, my name's Jamie Shulak. I'm with the respiratory department. I'm here. Introduce yourself to the patient by name and department and inform them of the purpose of your visit. Ask the patient to identify themselves by name and date of birth. This information, including the MR number, may be found on the patient's armband and may be used to confirm patient identity. Explain the procedure to the patient in lay terms. Ask if they have any questions or concerns before you begin the procedure. Collect all of the necessary equipment, including an arterial blood gas kit, alcohol prep pad, 2x2 gauze, a Band-Aid, face mask or goggles, whichever you prefer, and a biohazard bag. And a cup of ice is optional if clotting time is anticipated to be slow or greater than 10 minutes. Wash your hands for at least 30 seconds using running water, soap, and applying friction. You may use a foam sanitizer to replace this procedure. Place your personal protective equipment on, including gloves, face mask or goggles, in the event of splashing. Record the vital signs prior to insertion and include the following information: the heart rate, the respiratory rate, the FiO2 or oxygen tension, body temperature, and the blood pressure. Note the time of the procedure. Position the patient so that you may easily access the radial artery. Remove the armband and replace it to the adjacent arm if needed. The radial artery is the preferred site since it is superficial to the skin, therefore easy to palpate, and the hand has collateral circulation through the ulnar artery in the event the radial artery is damaged. Conduct a modified Allen's test to check for collateral circulation. When conducting a modified Allen's test, occlude both the radial and ulnar arteries by applying pressure to the wrist where the vessels are located. Ask the patient to squeeze their hand 3 or 4 times. The color in their hand will blanch white. Then you want to release the ulnar artery. Color change from white to pink within 5 seconds indicates adequate collateral circulation. When preparing the syringe, ensure the heparinized pellet is at the tip of the syringe closest to the patient. This will prevent clotting as blood passes by the heparinized pellet. Secure the orange safety stand in an upright position. Prepare the site with an alcohol prep pad. Palpate a pulse to determine the location or entry point that you will puncture, and prepare the site with the alcohol prep pad using a circular motion starting from the center and moving outward using friction to expand your field. Hold the needle at a 45-degree angle with the bevel side up. Palpate for a pulse in the field that you prepared. Maintain that 45-degree angle with your needle as you prepare for insertion. Insert the needle until you see a flash of blood. It should be bright red. If no flash occurs during insertion, withdraw the needle in the same line that you inserted in order to redirect the angle of the needle. But do not withdraw the needle from the body. Withdraw the needle until the tip is nearly at the surface of the skin and just under, then redirect at a different angle towards the artery. When you hit the artery, you'll notice a flash of bright red blood. Allow the blood to fill the syringe and do not move while filling. When your needle and syringe are full, withdraw as you apply your gauze and pressure to the site of insertion. Hold pressure for about 3 to 5 minutes or until bleeding stops. Place the Band-Aid on the site of insertion. You'll need to mix the heparin to prevent clotting in the syringe and remove all air bubbles to ensure quality arterial blood gas sample has been obtained. Air bubbles will influence the PaO2 to rise. PCO2 will fall, and the pH will rise in the blood, distorting the patient values. If bleeding is anticipated to last greater than 10 minutes, place the blood gas sample on ice. Label the arterial blood gas with the patient's label. Transport the ABG in a biohazard bag and label the bag as well. Return the patient to a comfortable, safe position, raising the bed rails for patient safety. Check the site of insertion for any further bleeding. Ask the patient if there is anything else you can do for them prior to leaving. Discard all items in their appropriate container. Place all sharps in designated sharps containers. Take your arterial blood gas to an ABG machine or hospital lab. Follow procedures at the hospital by inserting and running the arterial blood gas sample for analysis. Discard gauze, gloves, and syringe in their appropriate receptacle. Document all patient values and arterial blood gas results, noting the time you performed the procedure in the patient's medical record. Notify the physician immediately if you discover critical values, and document the time and method of notification, including by telephone, in person, or other approved methods of communication by the hospital.